We are grateful for the opportunity to present our poster to you today focused on findings obtained through our ITP Natural History Study Registry. Our study's focus addresses whether ITP patients who have had a splenectomy have increased risks for platelet count drops following COVID-19 vaccination. Our disclosures. This was a prospective cohort study. The ITP Natural History Study Registry is composed of 7 surveys designed to collect information on participant demographics, medical history, treatment history, quality of life in adult and pediatric ITP participants, and their experience with COVID-19 infection and vaccination. Our COVID-19 and ITP survey launched in February this year. The registry is accessible to members of the Platelet Disorder Support Association. As of June this year, 241 adult ITP participants who had at least one dose of a COVID-19 vaccine reported a post-vaccine platelet count and who disclosed their splenectomy status were included in this study. Participants were separated into different groups, those who were splenectomized versus those who were not. This was so comparisons could be made regarding any quantitative differences in reported platelet count changes post-vaccination between the two groups. The splenectomized group was comprised of 59 participants, representing 24% of the participants included in this study, and the non-splenectomized group was comprised of 182 participants. To provide you with an overview, starting with dose 1, platelet count drops were reported in both the splenectomized and non-splenectomized participants, as illustrated in Figure 1 here. We found that non-splenectomized participants were far more likely to experience a platelet count increase compared to splenectomized participants, and this difference was statistically significant. We also found that there were no significant differences in the number of platelet count drops reported between both groups. These findings were also seen following receipt of dose 2. When we compared platelet count changes, both increases and decreases reported following receipt of dose 1 and dose 2 of a COVID-19 vaccine between both study groups, we saw that regardless of splenectomy status, most of the participants, in fact 72%, reported the same platelet count result for both dose 1 and dose 2. Although there were more platelet count drops reported following dose 1 than following receipt of dose 2 in both study groups, these differences were not statistically significant. When we looked at large platelet count drops defined as a platelet count decrease greater than 50 to 100,000 cells per microliter of blood, splenectomized patients were far more likely, if they reported a platelet count drop at all, to experience a large drop over 50,000 compared to the non-splenectomized group, and this difference was statistically significant. Following dose 2, similar trends were noted. There were no significant differences in the number of reported platelet count drops between both groups, but when we looked at the types of platelet count drops reported, we again saw that the non-splenectomized participants were more likely to experience a platelet count increase compared to the splenectomized participants, and this difference was statistically significant. We also saw again that large platelet count drops were more common among the splenectomized participants, and this difference was statistically significant. Adult splenectomized participants are not more likely to experience a platelet count drop compared to non-splenectomized participants. However, if they are going to experience a drop, splenectomized participants are more likely to experience a larger drop in platelet count compared to those who have not had a splenectomy. This should serve as a reassurance to ITP patients who may be hesitant to receive a COVID-19 vaccine due to their splenectomy status. Splenectomized adult ITP patients can be safely vaccinated with close monitoring and planning with a hematologist familiar with ITP. Future studies could focus on identifying additional factors affecting platelet count changes post-vaccination, which in turn would lead to a better understanding of platelet variability in ITP patients. Thank you all for listening to our presentation.